everyone, it's Kelly and welcome back to room 9 3/4. Today we are going to be talking about EKGs. So I'm going to bring you up close and personal with our EKG machines that we keep in the department, and then we're going to look at proper lead placement here on our mannequin. So we'll go through the standard 12 lead EKG placement, your right-sided EKGs, and then your 15 lead EKGs as well. We don't do right-sided or 15 leads very often, but it is something that we should all know how to do. So I'm going to bring you up a little closer and we'll talk about our EKG machines. Now, we do keep these machines stocked throughout our department. We keep several on the floor, the East Wing Annex area, the triage area, and in room 9 as well. One of our department goals is anybody presenting with chest pain, we do try to get an EKG within 10 minutes of their arrival. So we are working on that, and we try to keep these in appropriate areas for that goal. So let's move you in a little closer here. So as you approach the EKG machine, you'll kind of see some features. This usually travels with the face of it down. So we keep all of our lead clips kind of rolled up on the back of them here. But when you open it up, you'll have 3 buttons across the keypad here, and then there's going to be some buttons on the screen. So we'll go ahead and we'll turn our EKG machine on. It'll take a minute to boot up here. Now these pull up in the automatic standard 12 lead EKG, so every time that you open it, it should be again in your standard setting. We don't put labels on these machines. When we return these machines, we try to make sure that they are plugged back in and charged. We do keep error logs on all these machines to report anything that's happening with the machine or any issues you may have. The EKG techs in the hospital also round pretty regularly on these machines to make sure that everything is crossing over and acting as it should. So some features when you get a little closer here, you'll have a row of buttons at the bottom, in the top. Big thing about these buttons, one, if you ever forget where to put your EKG stickers on in the moment, you can hit this map button here, then it will bring up where you're supposed to place all of your lead stickers. So that's just a little way to help you if you ever forget in the moment. Second big thing about this is the ID button. So you can click it on the screen and it is a button down here. We want to make sure we put in all of our patient's information to ensure that it crosses over into their chart and is appropriate to the patient. So please make sure that you are filling this out when doing your EKG. And then the third button we have over here that we also have down here is the EKG button. Now, when you do hook these up, these will come up with your EKG. You want them all to be green, showing that they are all reading appropriately and accurately. When they all do become green, this green button down here will light up. If you hit that twice, it'll go ahead and print you out that EKG. Now, when you are printing out your EKGs, you want to print out 2 copies of your EKGs. You want to give one to the physician to sign. Our physicians that can sign EKGs include attendings, third-year residents, and then second-year residents after December of their second year. So make sure you're handing it to the appropriate person. And then you want your second copy for the nurse and to stay with the patient's chart and information. So make sure you're printing out those 2 copies and then that you're handing one to the physician and one to the nurse. So we also want to make sure that these transfer. So say we hit EKG on here, it will bring up what our EKG, this is just saying that I haven't put any patient information in. We'll continue. You can also take the EKG in an emergent situation. You can hit the button, take the EKG, and then put the patient information in. But as long as the information gets put in so that the EKG can be transferred into their chart, that is the most important thing. The other thing, so it'll pop up like this. It'll have your EKG. It'll have your patient information at the top. And then it'll have over here like your rate, your QTC, things like that. You want to make sure that this transfer button is hit or grayed out depending on if you have already printed it twice and it's transferred. But we want to make sure that we hit this transfer button if it's available to transfer that into the patient's chart before we print our second EKG. And again, that's just to ensure that all the providers are able to see that in the electronic medical record. We will close this. Another thing I want to talk about is continuous EKGs. We do this on patients that are going to get like adenosine or something like that. So you'll put up in your standard 12 lead and you'll hit this rhythm button down here. Once you hit this rhythm button, it'll bring up 3 leads. You'll go to leads. You'll select all. this will select all 12 leads, so it'll start printing a continuous 12 lead EKG out of the side of the machine here. So again, rhythm, you're in your 12 lead, it'll start continuously printing out your 12 lead EKG here. When you're done, you'll hit this stop button. Now, if you stop in the middle of the pages, all the pages are perforated, so that it only prints out one page per EKG. So you'll hit this page over button so that we don't mess up the pages in the machine. And then you can rip off at the perforated edge here. So you'll just rip this off, along its perforated edge, and that will be the EKG that you give the provider. Several things I want to talk about. We keep this drawer down here. Most of them will have a pack of extra EKG paper and then a bunch of extra EKG stickers. We do also stock both of those in our tube-in system in the clean utility room. So both of those are stocked. And then the paper tray is over here on the side of your EKG if you need to replace the paper for whatever reason. Okay, so now that we have gotten a little up close and personal with our EKG machine, let's talk about lead placement. So I'll go over lead placement here, and then I will bring you up and close to our mannequin to really get a good look at where I'm placing these leads, but I'll just talk you kind of through it at first. So there are 12, 2, 4, 6, 8, 10, 11, 10 EKG stickers that you need to place. Sorry, math is hard. On your mannequin, or your patient. This mannequin, unfortunately, does not give us the opportunity to show the arms and legs portion of where you're supposed to place your lead, so I will show you those here in a minute. But I will start with the main bread and butter of your EKG, the chest lead placements. So you want to start with V1 and V2, and those are going to go in your fourth intercostal space, and that's going to be on either side of your patient's sternum. And EKG lead placement is very important because it gives us the best and most accurate picture of the heart. So it's very important that we put these stickers in the right lead placement areas. So fourth intercostal space, we'll go right side of the sternum for V1, left side of the sternum for V2. And then this is just personal preference, you can do whatever you'd like. I go to V4 next, so I skip V3 for the moment. And that is because V4 is going to be your fifth intercostal space, and it is going to be in your clavicular line. So mid-clavicular, kind of fifth intercostal space. Most patients, it is kind of got to line up with the nipple line there. So I'm going to go ahead and place that sticker. And then V3, I go back and put in after V4, which is just going to go in between V2 and V4 there. And then you'll carry on. V5 is going to go in your anterior clavicular space. And then V6 is kind of going to go in your kind of axillary line there. So this is going to kind of wrap around the left side of your patient. And then I will show you kind of up close where you would put them on your patient's arms and legs. So you're going to have one on each extremity, and then you're going to have the ones on the chest. So for arms, what I will do is you want to put them, you don't want to put your stickers ever over any bony prominences or bony places. So right here on the forearm, so there's bone here, go over here just a little bit, and that is where I will place my EKG sticker. I place this going up because it helps you with the clip-on lead placements. Now, for your legs, what you're going to do is you're going to place it right above your patient's medial malleolus, kind of on that medial side of your patient's leg, right above the ankle is where you're going to put it. You want to make sure that your patient is relaxed, their arms are at their sides, their legs are uncrossed, all of that good things too when you are putting these EKGs on and attempting to take your EKG. So we're going to get closer to this mannequin here, so you can see the correct lead placement. So again, V1, V2, V3, 4, 5, and 6. And this is kind of going to just, again, wrap around your left side of your patient here. I will say anybody that is bigger chested or anything like that, if you do need to move some of that tissue around to put these stickers, please, please, please do that. Use the back of your hand. Just let them know, hey, you're going to feel the back of my hand. I just need to kind of displace some tissue here to place these EKG stickers. Again, very, very important that we put these in the right places to get an accurate view of the heart. Now, if you were to do a right-sided EKG on this patient, what you're going to do is every single one of these stickers is going to look exactly the same but mirrored onto this side. So what's going to happen is basically this is going to become V1, this will be V2, and then 3, 4, 5, and 6. And it will just wrap around the right side of your patient. So I'm going to show you kind of on here how to clip on the leads from the machine to your patient, and then we'll talk about 15 lead EKGs. So I'm going to try to do this one-handed. It's going to be a little tough. You all can make fun of me in the comments. That is fine. But we are going to show you how to do this. So all of your leads are labeled. So V1, V2, V3, and then they're also labeled on the part where they plug into the machine. Now, if you're getting a lot of artifacts from your patient or whatnot, sometimes if you push on these during the EKG from this part, it can kind of help with that. So that's just a little tip. So all these are labeled. So V1 will go here, V2, and you want these to be placed only on the blue part of these stickers. You don't want it on the goopy, gooey part because then it will not read appropriately. So just the blue tabs of these stickers, and you want the blue tabs of your clips to be facing outward. Another thing that can sometimes happen is, you know, these are just like kind of clipped in there. These can get goo on them from the stickers and things. So if you are having some troubleshooting issues, you can just take a little alcohol swab and kind of put the alcohol swab in between these clips and kind of wipe it off if you're having some kind of goo on your clips. Sorry, patient. It's usually easier to do this with 2 hands, and it doesn't stick to patients all that well. Okay, so this is how your clips are going to look when you are doing them for the EKG. Now, the other thing about your stickers is you want them to be firmly on your patient. Obviously, the mannequin is very smooth, doesn't have any hair, isn't diaphoretic, anything like that, so they're sticking rather well. But we all know that that's not the case with every patient. So if your patient is super diaphoretic or anything like that, please take the time, take a washcloth, wipe them off, try to get these stickers to stay. If they have a very hairy area where you're trying to attempt to put these stickers, you can shave that area and put the stickers on. They do say that the pin trick works. I don't think we'll go into that on this video, but again, just please make sure that these stickers are firm to your patient's skin. So after that, again, on your EKG machine, the lines will start popping up with your patient's rhythm, and when all those lines turn green is when your EKG is good to go. Again, we want to try to decrease as much artifact, so if your patient is like shivering or if your patient is breathing very heavily or things like that, you know, you can let the provider know, see if there's anything that we can do to kind of help to get a better EKG. So that is, again, your standard 12 lead placement, including, and then, you know, you have your arms and legs, and then these are also labeled. So this is your left arm here, and then this will be your left leg clip. So just make sure that you're putting those on the right sides of the patient when you are placing your EKG clips on. Other than that, we'll talk about the 15 lead real quick. Again, if you're doing a right-sided EKG, it will be just mirrored on the right side of your patient. But for the 15 lead EKG, we will have to move some stickers around. So I'm just going to show you here on the mannequin up close. So you're at your standard 12 lead at this point. So what we're going to do is we are going to leave V1, V2, and V3 alone. We're going to leave them exactly where they are. Now, V4, we are going to take and move to the opposite side, kind of where V3 would be on the opposite side of the chest. So we're going to move that on the right side. So it's kind of going to look in this fashion. Now, for V5 and V6, what we are going to do is move those to the back side of our patient. And again, you don't want to put these on any bony areas. So what you're going to do is you're going to find the scapula of your patient, and then you're going to go under the scapula. So you're kind of going to wrap it around the scapula towards the spinal column, like these are wrapped around the patient this way. So unfortunately, our mannequin doesn't have a very prominent scapula, so we will just kind of stick these back here. Take you around the back here a little bit. So they're kind of going to be on here, just around your patient's scapula. So again, you want to locate that. You don't want to put them directly on the scapula or anything like that. So that is, you will hook up your patient to your EKG machine. Again, you would hook the V4 clip here, and then your 5 and 6 clip on the back, and you would take your EKG that way. If you're doing a posterior EKG, which again is something that we don't do here very often, but might be asked for you to do, it's going to be your standard 12-lead EKG placement, but just around on the back of the patient. So you'll want your patient to be kind of in a prone position, and you will start, again, kind of imagining that this fourth intercostal space on their back and on either side of their spinal column, and then wrap their other leads kind of around the left scapula of your patient. And you'll hook those up like normal to your EKG machine, and that's how you'll take a posterior EKG. So that is where all your lead placements and stickers go, and how you clip them in. Again, EKGs can sometimes be difficult depending on your patient. You know, our machines are dated, but we do the best that we can in terms of artifact and things like that, and troubleshooting. So if you ever have any questions about doing an EKG, performing an EKG on a patient, please let us know. Refer to this video, come by our office. If you ever have an issue, please log it in the EKG issue log, and then let us know so we can help facilitate it being fixed. And other than that, that's how you do your standard and little special EKGs. So we'll see you next time on Room 9 3/4.